Welcome to Drug Digest. In this video, we're going to be talking about aspirin. In this video, we'll be discussing how aspirin works, its indications and uses, dosage and administration, side effects and precautions, and more. Let's get started. Introduction of aspirin. Aspirin is a widely used medication that is primarily used to relieve pain, reduce fever, and decrease inflammation. It belongs to a group of drugs known as nonsteroidal anti-inflammatory drugs, NSAIDs. Aspirin has a long history of use dating back to ancient times, and the modern use of aspirin began in the late 19th century when it was first synthesized by a German chemist named Felix Hoffmann. Different brands available in market. Aspirin is the generic name for the medication, but it is also sold under a variety of brand names. Here are some common brand names of aspirin: Bayer aspirin, Ecotrin, Bufferin, Ascriptin, Alka-Seltzer Original, Enicin, Excedrin, Durlaza, Zorprin, Aspartab. It's important to note that while these brand names may have slightly different formulations, they all contain the active ingredient acetylsalicylic acid, which is what makes them effective as a pain reliever. An anti-inflammatory medication. History of aspirin. Aspirin has a long and fascinating history that dates back thousands of years. The ancient Egyptians used willow bark, which contains salicylates, the active ingredient in aspirin, to treat pain and fever. The use of salicylic acid for medicinal purposes continued through the centuries, and in 1897, a German chemist named Felix Hoffmann synthesized acetylsalicylic acid, which is the active ingredient in modern aspirin. How aspirin works. Aspirin works by blocking the production of prostaglandins, which are chemicals in the body that promote pain, inflammation, and fever. Prostaglandins are produced by an enzyme called cyclooxygenase, COX. Aspirin works by inhibiting COX, which reduces the production of prostaglandins. Aspirin is a type of nonsteroidal anti-inflammatory drug, NSAID. It is different from other NSAIDs, like ibuprofen and naproxen, because it irreversibly binds to COX, which means that the enzyme is permanently deactivated. This is why the effects of aspirin can last for several days, even after the medication has been stopped. In addition to blocking prostaglandin production, aspirin also has antithrombotic effects, meaning that it can help prevent blood clots from forming. It does this by irreversibly inhibiting the enzyme thromboxane A2, which is involved in platelet aggregation, or the process by which platelets clump together to form blood clots. By inhibiting thromboxane A2, aspirin reduces the risk of blood clots forming in the blood vessels, which can lead to heart attack and stroke. Uses of aspirin. Pain relief. Aspirin is commonly used to treat mild to moderate pain, such as headaches, toothaches, and menstrual cramps. Fever reduction. Aspirin is also used to reduce fever, which is often a symptom of an underlying infection or illness. Inflammation reduction. Aspirin is effective at reducing inflammation and swelling, which can be caused by a variety of medical conditions, such as arthritis and injuries. Heart attack and stroke prevention. Aspirin is sometimes prescribed to people who are at high risk for heart attack or stroke, as it can help prevent blood clots from forming. Dosage and administration. The recommended dose of aspirin depends on the reason for taking it, as well as the individual's age, weight, and other health factors. It is important to follow the instructions on the label or as directed by a healthcare professional. For pain relief, the usual adult dose of aspirin is 325 to 650 mg every 4 to 6 hours, not to exceed 4 grams per day. For children, the dose is based on their weight, with a maximum dose of 3.6 grams per day. For reducing fever, the usual adult dose is 325 to 650 mg every 4 to 6 hours, not to exceed 4 grams per day. For children, the dose is based on their weight, with a maximum dose of 3.6 grams per day. For preventing blood clots, the usual adult dose is 81 mg, also known as a baby aspirin, or 325 mg per day, as directed by a healthcare professional. Aspirin should be taken with food or after eating to reduce the risk of stomach upset. It is important not to crush or chew enteric-coated aspirin, as this can affect how the medication is absorbed in the body. As with any medication, it is important to speak with a healthcare professional before taking aspirin, especially if there are underlying medical conditions or other medications being taken. Is aspirin safe for pregnant or lactating women? Aspirin is generally not recommended for use during pregnancy, especially during the third trimester, as it may increase the risk of bleeding and other complications for both the mother and the baby. Aspirin may also be harmful to a developing fetus, especially in high doses, and should not be taken without the guidance of a healthcare provider. Similarly, aspirin is not generally recommended for use during breastfeeding, as it can pass into breast milk and may harm a nursing infant. However, in certain situations, such as when aspirin is prescribed by a healthcare provider to prevent blood clots, the benefits of taking aspirin may outweigh the potential risk. In these cases, a healthcare provider will closely monitor both the mother and the infant for any signs of adverse effects. If you are pregnant or breastfeeding and are experiencing pain or other symptoms for which you would normally take aspirin, it is important to speak with your healthcare provider before taking any medication. They can help you determine the safest and most effective way to manage your symptoms. Risks and side effects of aspirin. While aspirin can be an effective medication for pain relief and other medical uses, it also carries some risks and potential side effects. These include increased risk of bleeding. Aspirin can thin the blood and increase the risk of bleeding, which can be dangerous in some situations. Stomach irritation and ulcers. Aspirin can cause irritation of the stomach lining and increase the risk of developing stomach ulcers. Allergic reactions. Some people may be allergic to aspirin and experience symptoms like rash, hives, and difficulty breathing. Here are the references from which I get the information.